My name is Dr. Kurt Belk, and I'm a board-certified emergency physician and the medical director of the Urgency Room. I want to thank you for choosing us as your healthcare provider. The following video offers follow-up care instructions to your recent visit.
I'm Dr. Waqas Ahmed, a board-certified emergency room physician. You visited the urgency room today to be evaluated for a contusion, which is an injury due to a trauma such as a car accident or fall. Pay close attention to the instructions you hear in this video, and please follow up with your regular doctor as instructed to make sure you quickly return to full health. After an accident, people commonly feel aches and pains in the neck and back. It's normal for aches and pains to feel worse the day after your accident, but they shouldn't be severe, and you should start feeling better during the next few days. Sometimes injuries from an accident prevent you from working. Follow up with your regular doctor to get a note for work and to find out how long you'll have to avoid working. Either pain medications or your injuries may make it unsafe for you to drive or operate machinery. Please follow the guidelines your urgency room healthcare provider gave you. At home, you can apply ice to injured areas for the first 1 or 2 days. Apply a bag of ice wrapped in a cloth or towel for about 15 minutes at a time. You can do this as often as once an hour. Don't sleep with an ice pack or apply it directly to your skin, since it can severely damage your skin or cause frostbite. If you're experiencing pain, you can use non-prescription pain medicine, like acetaminophen or ibuprofen, if your urgency room healthcare provider or your own doctor told you this is okay. Make sure to limit your activity for at least 1 or 2 days. A good rule of thumb is to avoid doing things that hurt. You need to see your doctor if any injured area is not back to normal in 1 week. During your examination at the urgency room, your doctor may have placed a splint or dressing on your injury to protect it. Return to see us right away if your injured area gets more painful, if the splint or dressing seems to be too tight, if it gets numb or tingly past the injury, or if the area past the injury becomes pale, blue, or cold. Keep the injured area elevated above the level of your heart as often as possible to help lessen the swelling or puffiness and the pain. A splint is meant to be temporary. Your regular doctor or orthopedic doctor will remove it and replace it with a cast or boot if needed. If you're wearing a splint, make sure to keep it dry, and don't remove your splint by yourself unless told to by your doctor. Return to the urgency room right away if you have abdominal pain or bruises, chest pain, pain in a new area, or pain that's getting worse. If you get short of breath, you develop a fever of more than 101 degrees, you have weakness in your arms or legs, you faint or feel very lightheaded, you have any new symptoms, you're feeling weak or unusually ill. Injuries to the brain are possible with any accident. Visit the urgency room immediately if you have confusion, vomiting more than once, difficulty walking, or a headache that's getting worse. If you have any reason for concern, don't hesitate to return to the urgency room for fast medical care from a board-certified emergency physician.
These videos are intended to provide helpful health information to the general public. They are not intended to be a substitute for professional medical advice. You should not use this information to diagnose or treat health problems, and you should not use these videos in place of a call or visit to a medical professional. Talk with your physician about the proper treatment for your particular condition, and always follow your physician's advice. If you think you need an ambulance or are experiencing a medical emergency, please dial 911 immediately.